Hi dears, once again welcome to my OIT channel. Today we will see another one OIT letter writing to the casualty physician. So this is the patient name is Betty Olsen. So let us see the case note. So the starting date is 15/7/2019. Your patient is Mrs. Betty Olsen. She is a resident at the Wellness Retirement Village. She needs urgent admission to hospital. You are the registered nurse looking after her. Patient details: address is Wellness Retirement Village, Waterford Street, Berkeley, and phone numbers are given. Date of birth is 29/1/1968. Marital status is widowed. Country of birth Australia. Social history: moved to retirement village following the death of husband due to a heart attack in December 2017. Next of kin: son Benjamin Marshall, crippled for life after a right side paralysis a month ago. Mrs. Marshall not aware of this. 53 Gladison Street, Warwick, and a phone number. Normally, patient is alert and oriented, reading, watching television. Medical history: she has hypertension last 10 years, one pack cigarettes per day almost stopped 5 years ago, alcohol, 2 glasses of wine at bedtime daily, glaucoma since 2010, allergic to codeine. So what are the things I have mentioned in yellow marker? These all have to keep it in your mind, that is relevant data. And medications are under prescription. There are some more medications are there. Captopril 25 mg BID and Timoptol eye drops and Normison, and some non-prescription medications are there. Over-the-counter medications also has given here, like vitamin tablets. Mobility: regarding the mobility and aids, independent with walking frame. She has arthritis in hands, wear contact lenses. Continence: requires continent pad. Recent nursing notes: 28/6/2019, flu vaccination, influenza type B prophylaxis. 12/7/2019, complaining of epigastric pain and indigestion following evening meal. Pain settled with Buscopan tablet per oral. On 13/7/2019, unable to sleep, aching shoulder, settled following 2 Panadol and diclofenac 75 mg intramuscular. Sound sleep for 7 hours. 15/7/2019, tired and feeling generally weak. BP is 180/95, confined to bed. GP called and will visit tomorrow. I was busy. That means general practitioner told he will visit later. Requested Buscopan for indigestion, Panadol for shoulder pain. 15/7/2019 at 8 p.m. Buscopan tablet, Panadol 2 tab per oral given. Didn't touch the evening meal. Says not feeling hungry, trouble sleeping. And the BP reading was 175/95. Anxious, strong, persistent wish to see son. Sometimes is miss. Why is he not paying a visit? This is patient's concern of her son. Rechecked, distressed, pale and sweaty, complaining of tightness and pain in the chest, pain rated 8 out of 10 on pain scale, complaining of radiating shoulder and neck pain, pain not relieved with Buscopan and Panadol, BP again 190/100. So they are suspected to have myocardial infarction. Oxygen administered through nasal prong 2 liters per minute, nitroderm transdermal patch applied, but still complain of pain. So they call ambulance and patient is referred. So these all the time is mentioned 8/8/25. These all are relevant data for us. Writing task: write a letter to the emergency consultant of the Holy Spirit Hospital Emergency Department. Give the reason, history, and reason for urgent referral. So by reading this writing task, we can conclude that this is a referral letter requesting an urgent admission in the emergency department, and we are going to write the letter to emergency department physician at Holy Spirit Hospital. So I hope it's clear for you. So when you are go through the writing task, I mean the topic, What were the relevant data? You have to just underline. What were the thing I mentioned here with yellow color? You can just underline the date admission. I mean the starting date 15/7/2019, date of birth, the patient's marital status, and regarding social history, if you want to mention this regarding the son, it's okay to say relevant data. And the medical history regarding the hypertension, alcohol consumption, glaucoma, allergic to choline, and the prescription drug, only the prescription drug is needed. Then the patient have arthritis, that one have to be underlined. Then we have to see the complaint started from 12/7. So that is only the thing. And what are the medication they have administered at that moment. Then again, regarding 15/7, what are the things happen? These all are important, including the BP reading. Then the same day, 8/25. So these are all things until the referral we have to mention in our letter. So we will see the letter. So date and address 15 July 2019. Address is the emergency consultant, Holy Spirit Hospital Emergency Department. Here they didn't give the reader a name to whom we are going to write. So we can mention here the emergency consultant, or else no need. If there is name is given, the name, and you can write emergency consultant. Here no need of I mean there is no name. How to write the emergency consultant. Salutation, dear doctor, regarding Mrs. Betty Olsen, date of birth 29 January 1968. Purpose paragraph, because here there are suspected, they are suspecting the case may be acute myocardial infarction. So please keep it in your mind. The reason present medical condition is suspected to have acute myocardial infarction, and the requirement is urgent admission to the hospital. So let us write like this. I am writing to refer Mrs. Betty Olsen, who is suspected to have acute myocardial infarction. She requires an urgent admission and immediate interventions. So here we will introduce the patient with the full name and the reason present medical condition, and the requirement is urgent admission and immediate intervention. So the next thing, present medical history. Here we have to sum up within in a short, because we are going to write the letter to a doctor, so no need to write everything like irrelevantly. So he can conclude like this. Mrs. Olsen presented on 13th July 2019 with the complaint of pain in shoulder for the first time, which was resolved with the medications. So we will start writing with the, because this is the letter from nursing home, so this is not admitted or something else. The patient is already there. On our in our normal routine, we just started to see some discomfort from the patient, some complaints from the patient from 13th July 2019. So we can write Mrs. Olsen presented on 13th July 2019 with the complaint of pain in shoulder for the first time, and we managed already, which was resolved with the medications. Then again the problem started today. So today morning, she was seen weak and confined to bed. Her blood pressure was recorded high as 180/95, which was informed to her general practitioner, but he could not visit her because of busy schedule. So this is the thing happened in the morning. She was seen very weak and confined to bed. She didn't eat. Her blood pressure was recorded very high. So everything was informed to her general practitioner, but he told, I will see her tomorrow morning because of busy schedule. This is the first part of the present medical history. Let us see the second part of present medical history. So if you feel the letter present medical history paragraph it is big, you can split it like this. You can make it two paragraphs. So here, because it should be relevant, first paragraph we have informed regarding today's morning events, and the second paragraph we are going to write what all the things happen during evening time. So today evening, Mrs. Olsen complained worsened pain on her shoulder along with indigestion, for which she was administered with 2 tablets Panadol and 1 tablet Buscopan. Here you have to just keep it in your mind before for which there is comma. Then on reassessment, this is hyphenated word, reassessment, comma, she was found distressed, pale and sweaty, as well as her blood pressure was 190 over 100. Here we are writing two observations. One is on reassessment, how the patient was seen, distressed, pale and sweaty. Then we are going to write our reading. So that is blood pressure reading. So we can use the connective like as well as, even after and we can write as well as her blood, because we are separating two scenarios but in the same sentence. Blood pressure was 190 over 100. Then the next connective, in addition, comma, she complained to have tightness and pain in the chest, which radiates to shoulder and neck. Again, this, comma, she was provided with oxygen therapy and applied nitroderm transdermal patch. So that is the management what we have done there. Then we have to write that even after all these managements, nothing changed. So we can use even though, comma, her problems persist. This is the reason for her immediate referral to your facility. So this is a small conclusion actually for the non-medical, other than community health nurse, other than the nursing letter, we can use a small conclusion here. Even in the nursing letter, nurse to nurse letter, if it is relevant, we can write. So this is for the clarity, extra clarity for the reader. So today evening, Mrs. Olsen complained worsened pain on her shoulder along with indigestion, for which she was administered with 2 tablets Panadol and 1 tablet Buscopan. On reassessment, she was found distressed, pale and sweaty, as well as her blood pressure was 190 over 100. In addition, she complained to have tightness and pain in the chest, which radiates to shoulder and neck. Thus, she was provided with oxygen therapy and applied nitroderm transdermal patch, even though her problem persists. This is the reason for her immediate referral to your facility. So, by this, the doctor can understand that they tried everything, but the problem persists. So, something is urgent. So, this is the present medical history paragraph. Next, we will see the social history paragraph. Here we have to write personal history. We can conclude medical if there is surgical and if there is any allergies. So we will start like Mrs. Olsen is one of our residents in Wellness Retirement Village for the past 2 years. She consumes 2 glasses of wine daily. She has had glaucoma since 2010 and hypertension for the past 10 years, for which she is on captopril 25 mg twice daily. In addition, she has arthritis and is allergic to codeine. So here we are writing related to personal history. That means she is the resident in the village for the past 2 years. And regarding the drinking and smoking no need to write here actually. So she consumes 2 glasses of wine daily. Then here you have to pay attention. Here already they have given the year from when the glaucoma started. So if the year is mentioned, we can write she has had glaucoma since 2010. And for the hypertension, there is already given 10 years. So we can write and hypertension. So this has had is common for both glaucoma and hypertension. Hypertension for the past 10 years, and she is on medication for hypertension. So here we have to write for which, comma, for which she is on captopril 25 mg twice daily. In addition, she has arthritis. There is no year mentioned. So she simply has arthritis and is allergic to codeine. So simply we just concluded the social history. Next, we will see the recommendation paragraph. So, this is the letter for the doctor. So, nothing is there to be written other than 2 sentences. It would be appreciated if you could consider Mrs. Olsen and arrange an urgent admission in your facility. And another one more sentence, kindly provide her an immediate intervention as you feel appropriate. So, here nothing is there. The content to be written, because just we are requesting an immediate, urgent admission. So we can use it, it would be appreciated, and the connective, another one connective, it is kindly. So it would be appreciated if you could consider Mrs. Olsen and arrange an urgent admission in your facility. Kindly provide. This sentence is common for all letters for doctors. That means kindly provide her an immediate intervention as you feel appropriate. So this is simple and humble recommendation paragraph. The last paragraph is the conclusion paragraph. It is common for all letters. Please do not hesitate to contact me if you have any queries. The next one, since there is no name for the reader, you can write yours faithfully, not sincerely. Yours faithfully, registered nurse. So that's all the content of the letter. I hope this is